Hey gang, welcome to Wisdom Wednesday here at beautiful Austin Dental Spa in beautiful Austin, Texas. And I'm giving you the horns up because it's a big night tonight down at the UT, right next to the stadium. They finished the new basketball arena, which is called Moody Center. It's a concert venue slash basketball arena, similar to Rupp Arena and some of those places around town that opposing teams hate to come and play because the Irwin Center was just a little bit too big. It held 30,000 people, and on basketball nights, more than half the place was empty. This new stadium will only hold 10,000 basketball students when they've got the basketball set up, but they've got a concert tonight with John Mayer is tonight. George Strait next week with Willie Nelson. The Eagles are coming in May. Bon Jovi and Justin Bieber are also coming. But the big grand opening is tonight. Matthew McConaughey will be there as the MC. All right. So that's what's going on in Austin, Texas, open in springtime. So Hope you're down to the Moody Theater or Moody Center. I've got to get that right. The Moody Theater is completely different and 2 blocks away from where I live downtown. So we're going to talk about something. We always do a scientific portion and then we do a health tip. If you're watching Wisdom Wednesday for the first time, we also have a theme every month. And this month for April, it has been spring into spring. And so I'm glad we only have one more week left of that because my knees can't take too many more of those springs into spring. So anyway, we're springing into spring with some information that'll help you lead a healthier lifestyle and feel better about yourself. And so we've covered some of that with cosmetic dentistry. Today we're going to talk about a subject near and dear to a lot of people's hearts, not so much to their noses and sinuses. We're going to talk about allergies and can allergies and asthma affect your teeth? Well, we'll get to that in just a second. But first, I want to tell you about a report. This was surprising for me. My researcher found that the Asthma and Allergy Foundation of America, I didn't even know there was such a thing, but that's not really a surprise. Their 2022 report on the 100 least desirable places to live if you suffer from allergies. Number one, well, let me tell you where Austin was, because I thought Austin has climbed up to where they're probably in the top 5 because everybody in Austin seems to have allergies. But they ranked it according to higher than average spring pollen, higher than average fall pollen, and lack of the number of board certified allergists and immunologists per capita. So that was their ranking system. Number 61 last year moved to number 67, and that would be Austin, Texas. I would have thought they'd be at least in the top 50, and if not the top 10. But guess what? Of the other major cities in Texas, San Antonio got the number 5 spot, 80 miles down the road. Never would have believed that. El Paso holds the number 15 spot, so they're in the top 20. Dallas was next with number 28, and Houston at number 34. So we had all 5 major cities in the state of Texas were on the list, but not ranked in the top 10 except for San Antonio, and not ranked in the top 20 except for San Antonio and El Paso. So that was a bit of a surprise to me. I think some of it has to do with that third category of the number of allergists and immunologists per capita, because that Austin has plenty of them, because there's plenty of work for them here. So that probably moved us down the list. What was the number 100 city? Seattle, Washington. What was the number 1 city? Scranton, Pennsylvania. Never been to Scranton, but for sure don't want to go there now, and I certainly wouldn't want to live there. So anyway, there's your allergy background. Austin doesn't rank all that highly. Number 67 this year after being number 61 last year. So we're moving in the right direction. We're trending in the right direction. That either means we've gotten a whole lot more allergists moving to town, or maybe the pollen wasn't so bad this year. I can tell you that I walked out last week to the parking lot, and the wind had been blowing, and it looked like somebody had gone out and sprayed my car with green dust. I could have written my name, or drawn symbols on the windows or the roof of it. It was just completely covered, and it all blew off as soon as I got in and started driving. But if you've got itchy, sneezing, allergy issues or asthma, scratchy throat, all those kind of things, you know what I'm talking about. Cedar fever, all those pollens in the air. So let's talk about how those potentially can affect your teeth. Well, the number one way they affect your teeth is dry mouth. And that happens two different ways. If your nose is stuffed up and your sinuses are clogged, you're going to breathe through your mouth, because breathing is generally an activity that most people seem to enjoy. A lot of people do it. If you're breathing through your mouth, it's going to dry your teeth out, and it's going to dry your saliva out and leave the sticky part. So it's going to increase the stickiness factor in your mouth, which means bacteria and food particles are going to collect around your teeth, on your tongue, on your gums at a much higher rate than they would if you were not breathing through your mouth and breathing in through your nose. So that's one way that dry mouth can be caused. Another effect of dry mouth is if you're taking antihistamines. That's going to dry you out, so it does the same thing as if your nose were clogged up. But that dry mouth can cause dental problems, mostly more gum tissue problems than decay, but at a chronic rate, it could potentially cause decay on your teeth. Number two, tooth pain. We see this regularly in Austin, Texas, every fall and every spring when the pollen count goes up. People come in with upper back teeth hurting, and they think it's dental pain, and we take x-rays and see that the roots of their teeth, the three roots on the upper molars and the sinus area, is just like that or just like that, somewhere in close proximity, but the roots of their teeth stick up or into their sinus area. So when they get increased sinus pressure, that feeling that somebody's blowing up a balloon inside there, and you get all that pressure, or if it gets filled with fluid, either way it's going to put pressure on the nerves and the blood vessels going into those upper teeth, and it can cause pain that's very similar to a toothache. I tell people, if you take an antihistamine and the pain goes away, then it's not a dental problem, because more often than not, we take x-rays, we look the area over, there's no problem with the teeth. It's the sinuses that are causing the problem. So that could be the cause of your tooth pain. It can, in rare situations, affect the lower teeth, because that increased pressure on the upper teeth pushes them down out of their socket just slightly, maybe the thickness of a grain of sand, but it makes them hit the lower teeth harder. And if you've got big fillings or some kind of other issues with the lower, it can make the lowers hurt. Anyway, that's number two. Number three, bad breath. We see this commonly in the fall and in the spring. People coming in here and saying usually their spouse or their girlfriend or boyfriend has complained that their breath suddenly doesn't smell so good. And that's because of that post-nasal drip going down the back of their throat. Number one, increases the stickiness factor back in the back of the throat. So the same thing that can happen in the mouth on a dry mouth sufferer can also happen back in the back of your throat. That's where all the sulfur producing bacteria hang out, is on the back of the tongue and down the throat. They actually help you digest your foods, but they also, if they accumulate in too great of a quantity, they can give you that awful smelling breath. So fortunately, there are mouthwashes and other chemical agents that can help with that. Gargling with salt water will help with that some. Number four, swollen gums. Now this is a little bit of a rare one, but I already mentioned it earlier with the dry mouth syndrome. Your gums can actually get swollen if your mouth gets too dry and stuff accumulates around your teeth. So it's not a direct effect from your sinus issues or from allergies, but allergens don't directly affect your gum tissue, but they can cause them to swell up and be painful, or the dry mouth can cause them to be itchy, burny kind of sensation. So swollen gums are going to make you a little more self-conscious about smiling. If you're seeing blood when you brush your teeth, that can be an issue. So there's 4 ways that allergies can affect your dental health. My health tip for the week. I got more than one this week, and they're all related to what we just talked about. Keep your windows closed at home and in your car. It feels nice to drive around as the weather's starting to warm up, to roll the windows down when it's in the 80s. But that also lets all those allergens in that we were just talking about, the pollutants that are in the air, the pollens, the cedar, all that stuff is going to come into your car, and it potentially could affect you. Same at home. If you're leaving the windows open and the wind blows in, it's going to blow all that same green stuff that blew onto my car last week into your house and could affect you. Daily, you can use a saline nasal rinse. They have them out there. Most pharmacies have them. People know about the little inhalers that you squirt up into your nose. Those have various ingredients in them, but that can help because it's got antihistamines in it, and it has saline in there to kind of flush things out. Number 3, you can take an allergy pill like Zyrtec or one of those Sudafed. Those are the most common ones. They'll tend to be an antihistamine that dries you out and keeps you from suffering so much and lowers that sinus pressure. And then, worst case, you can see an allergy specialist. We got a bunch of them here in town, which I suspect is probably what moved Austin from 61 to 67, because we have so many good specialists here. If I was an allergist, Austin is where I'd be wanting to practice, because there's so many people running around with spring and summer with these issues. So that's it for this episode of Wisdom Wednesday. Thanks for tuning in. I will see you next week on Facebook and Instagram. Thanks for tuning in. Have a great week. Bye.